Hi, hi. This is Dr.J.RANJIT, Senior Lecturer, Department of Periodontics, and I'm here to present on clinical application of soft tissue laser for undergraduates. So, so before going into what to know about lasers, we should know how the periodontium is. So in this slide, I have put a comparison of an healthy periodontium with the compromised periodontium with pocket formation, attachment loss, bone loss. So in periodontitis, we have anaerobic bacteria flourishing in the periodontal site. Along with this, uh, with the subgingival environment, which is ideal for anaerobic pathogenic bacteria, along with the anatomical anatomical root structure, which has like dilaceration, fusion, hypercementosis. So all these factors will add additional benefits for the anaerobic bacteria to flourish in the periodontal site. Now, how do I eliminate that plaque biofilm, the bacteria? The gold standard is mechanical disruption. So by mechanical debridement, I try to get rid of this plaque biofilm. But am I doing it? Am I fulfilling 100% to get rid of this plaque biofilm? Definitely not. So, so then came an adjunct treatment. So along with the mechanical debridement, I use a local drug delivery or a systemic delivery, which has additional benefits to uh, to the mechanical debridement and getting rid of the microflora. But do we achieve 100% success in eliminating microflora is still a question mark. So thus came a novel system with mechanical debridement. The additional, we have the lasers. Lasers are nothing but light amplification by stimulated emission radiation. So, so what are the components of a laser? So the components of a laser, there is an optical cavity. The core of the cavity it has an active medium, which is in the center of the laser. And surrounding the medium, we have a reflecting mirrors. The medium can be solid crystals, liquid dyes, gases, or semiconductors. And we have to have an energy source to activate the medium where you have you have photons released. So how does this laser work? This light amplification by the stimulated emission of radiation. So how does it work? So we have an external source of energy. Once the energy reaches the medium, photons are released, and then these photons, what they do is they strike the atoms of the medium in the center. So once the photons strike the atoms, more photons are released. And these photons move back and forth, hit the mirror, reflect from, from the mirror. And then once this happens, atoms release more photons, which strike other atoms, continuing the process. And many photons are reflected back and forth by the mirror at each end. Once this is done, there is a small slit in opening from the mirror through which a beam of radiation passes out. Once the beam passes out, there is a difference between an incandescent light and a laser beam. So incandescent light has many wavelengths, multi-directional and incoherent, whereas laser beam is monochromatic with single wavelength, unidirectional and coherent. So once the beam passes out of the slit, it reaches the tissue. And when it reaches the tissue, what happens is it either gets absorbed, scattered, reflected, or transmitted to the surrounding tissue. Now, if it gets absorbed, what are the effects we have seen in the tissue? Photothermal, photochemical, photoacoustic, biostimulation, photodynamic, photovaporolysis, and photoplasmolysis. Now, what is this photothermal effect. So this photothermal effect is nothing but laser energy. When it reaches the tissue, it is transformed into heat. Once it's transformed into heat, we have uh, we can we can do with incision and excision, ablation and vaporization, and hemostasis and coagulation. So if case of incision, we need a small spot size. Ablation means a wider spot size. Coagulation is out of focus laser beam. So what is ablation? So when the beam reaches the tissue absorbs the beam of light, and what happens is the temperature reaches around 100 degrees. When it reaches around 100 degrees, the water content in the tissue is vaporized. And this process is called ablation. So this physical change of state, that is the solid and liquid components, turn into vapor in the form of smoke or steam. So if the temperature keeps rising from 100 degrees to 200 degrees, then what happens is the tissue becomes uh, a heat sink and results in charring of the tissue. So we have to know about 2 points: is what is a focused mode and a defocused mode. If I want to cut, if I want to cut, if I want to cut the tissue, if I want to cut the tissue, I use a focus mode. I use a focus mode, that is, in case of gingivectomy, operculectomy, I use a focus mode where the small diameter beam hits the tissue, 0.1 mm to 0.3 mm. And if I want to do a plasty procedure like gingivoplasty, depigmentation, I use a defocus mode. The focal spot is away from the tissue plane. Wider area of tissue is vaporized. Laser intensity or power density is reduced. So the tissue temperature, what do I achieve? In case of 37 to 50 degrees, it is hypothermia. 60 to 70 degrees, it's coagulation or protein denaturation. And 70 to 80 degrees, welding. 100 to 150 degrees, vaporization or oblization. And if above 200 degrees, then we have carbonization, also called as charring. So during the procedure, how do I keep the temperature in check? So I use a pulsed mode. That is, a pulsed mode is a laser that does not emit a continuous wave laser beam. Instead, they emit light pulse at some duration with some period of time between pulses and frequency measures per second. So I don't give a continuous uh, beam. So I stop in between. I give interruptions in between, and then gentle air stream from higher volume suction aids, and water spray reduces possible carbonization. So what are the types of lasers? So based on wavelength, we have argon, aluminum, gallium arsenide, indium, gallium arsenide, neodymium, yttrium, aluminum, garnet, erbium, scandium, and then you have erbium, yttrium, and carbon dioxide. But in periodontics, we use a diode laser for soft tissue therapy. So this diode laser is a solid state semiconductor laser that typically uses a combination of gallium arsenide and other elements such as aluminum, indium to change electric energy into light energy. The wavelength is 800 to 900 nanometer. And the light beam is delivered to the tissue with the fiber optic delivery system. So next, coming to the case scenarios. So where all can we use lasers? First is a frenectomy, high frenal attachment in the upper labial frenum. Now I have done a frenectomy using a diode laser, but here if you could see how I have charred the tissues over here. This is carbonization, charring of tissue. That means the temperature surrounding this tissue, there was about 200 degrees. So what will happen is there will be uneven full healing during the process. 1 week after the procedure, and patient will have mild discomfort. So this should be avoided. So charring of tissue should be avoided. Whereas in this, whereas uh, in this, I have again frenectomy with midline diastema, but here I have maintained a good temperature between 100 to 140 degrees. So what I have done is, so the resultant is there's no charring of the tissue, and the healing is more proper, and patient will be comfortable. Next is operculectomy. Operculectomy is pericoronal flap surrounding the third molar, seen mostly in the third molar. We can do a operculectomy using a laser, and we could see the healing, post-op healing after the laser, where there's no bleeding at all. Now, this patient had a ill-fitting denture and resulting in epilis fissuratum in the lower anterior region. So I had excised the epilis fissuratum using a laser. We could really appreciate, see, as there was no bleeding at all. Healing is satisfactory and patient is comfortable. So this is the epilis fissuratum and sent for biopsy. Next is a ankyloglossia, tongue tie. Patient had difficulty in speech and couldn't touch the upper central incisor or protrude the tongue. So with the help of a diode laser, we relieved the frenum. So the patient immediately could touch the tip of the incisors and protrude the tongue. Depigmentation is a routine procedure used with the help of a diode laser, and gingivectomy and gingivoplasty could be done with the help of a diode laser. So what are the advantages of laser? No smear layer, hemostatic effect, ability to seal vessels, protein coagulum, ability to cut, coagulate or vaporize, and selective precise interaction with tissues. Sterilization of wound site, reduction in post-operative pain, less need for sutures, reduced in operative time, and high patient acceptance. And then what are the safety measures when using lasers? So based on the laser, we have to, everyone in the room must wear protective glasses, use gauze pad, wet gauze pad on the patient's mouth. Reflective surfaces should not be used. All anesthetic gases must be removed from the room, and suction of vaporized tissue to reduce the laser plume. So from this presentation, one can decide whether lasers is a showpiece or a masterpiece. Thank you.